So there's been a lot of interesting developments in the neoadjuvant setting. Mainly the first one is the combination of PD-1 inhibitors in combination with chemotherapy. So currently the treatment strategy is chemotherapy, usually carboplatin and paclitaxel in combination with concurrent chemoradiation. This is based off the CROSS trial, but recently there appears to be some interesting data that the combination of PD-1 inhibitors with chemotherapy may not only have a benefit locally in terms of controlling local tumor control, but there potentially may be abscopal effect where they not only controls the local disease, but also prevent any disseminated disease or metastatic disease in the future. And so we're currently running a phase 1b study. It's led by Dr. Harry Yoon in Rochester, and Mayo Clinic, Arizona will also be participating, looking at the combination of carboplatin and paclitaxel with pembrolizumab in combination with radiation therapy. The other area that seems to be a lot of interest in the neoadjuvant setting is the use of PET-CT as a way to identify patients that are actually responders to chemotherapy and radiation. And so the initial results of the Alliance 80803 study, which Mayo Clinic participated in, was presented at ASCO GI. The results were very preliminary, but what it showed essentially was that in patients that do not have a PET response, which they identified as a less than 30% response in FDG avidity, were switched to a different type of chemotherapy. So patients were initially randomized to either FOLFOX or carboplatin and paclitaxel, and based on their PET response, they would either continue current therapy or switch to the other alternate therapy. And what it showed was that this may be a viable way to treat gastric cancer or esophageal gastric cancer. But again, these results were preliminary, and as the data continues to mature, we'll be able to identify whether or not this is a viable treatment strategy in this disease.